you as we get started. To Natalie Guyette for leading today's session on goal setting. We really appreciate your time, Natalie. Thanks everybody for coming. This is the first in a series of new webinars that we're trying out this spring. We'll do one a month just like this each time during the lunch hour for 30 minutes. So we'll have a presentation first, and then we'll have a chance to also have a discussion and some questions and answers. So go ahead, Natalie, take it away.
All right, thank you. Good afternoon. My name is Natalie Guyette, and I'm a certified and licensed athletic trainer. I have worked here at NMC for 6 years. I have worked in orthopedics and at local high schools, most recently at BFA. Currently, I am full-time at physical therapy here at Cobblestone. Since the start of the new year's here, I've created this presentation to help with goal setting and provide some nutrition and exercise tips and tricks. First, we're going to define what a goal is and what a resolution is to get us warmed up. Then we will go into what the top New Year's resolutions of 2022 were. We will talk about strategies to achieve your goals or resolutions. Then I have some simple nutrition changes that you can make to help your resolution, given that it involves eating healthier. We will also talk about healthy activity and simple exercises that will aid in healthy lifestyle change. We'll then have some time for some questions at the end of the presentation. What is a goal? Oh, crap. Hold on, my batteries run low.
First goal, plug your computer in.
I just got the notification. Okay. A goal is the object of a person's ambition or effort, an aim or desired result. What is a resolution? A resolution is a firm decision to do or not to do something. So resolutions are the ultimate end or change we want to make. In order to succeed or to get to our resolution, we have to have goals that will help us get us there. I thought this was an interesting poll that I found online. They asked 399 people what their 2022 New Year's resolutions were. And the results are as follows. Number 1, to exercise more. Number 2, to eat healthier. Number 3, to lose weight. Number 4, to spend more time with friends and family. And number 5, to live more economically. As I said earlier, in order to achieve the ultimate resolution, we need to create goals so that we are taking it one step at a time. First strategy to achieving each step or goal is to make them SMART goals. This is an acronym to help make it easier to remember the first components to making a goal. First, you want to make the goal specific. For example, instead of making a goal to walk more, make it more specific by saying you want to walk 3 miles 3 times a week. Next, you want to make the goal measurable. This is done easiest by having a benchmark to compare to what is reasonable to achieve. For example, if your standard or benchmark is walking 0 days a week, then maybe 3 days initially is unrealistic. But if you've been walking once a week already, then 3 days may be achievable. Which leads to the next criteria of goal making, attainable or achievable. I feel like it's easy to get carried away with goals because it's human nature to want to see change quick, and a lot of it, especially if we're talking about weight loss. Using our walking example, if you are one that has not been walking at all in the week, then maybe making a goal to walk 5 to 7 times a week is likely unattainable at first. Remember, goals are the steps we're taking to achieve the ultimate resolution or goal. So taking baby steps to get there will likely make you more successful in the end. Having the goal be realistic is also important. We kind of touched on this when talking about making your goals attainable. So again, you want to make sure your goal is realistic when comparing to your current lifestyle. Lastly, making your goal time-bound is important. This is what drives you to take action by giving your goals deadlines. So initially, you want to make your walking goal to walk 3 times, 2 times a week by February 1st, then progress to 3 times a week by Valentine's Day. Other strategies in addition to making your goals SMART are writing them down. Wait, sure. Oh, there we go. Oh, there we go. Writing them down with detail. After you write them down, make them visible. Again, you want to break it down and use a goal ladder to work to achieving those bigger goals. Next, develop a plan. This goes along with making the goals time-bound. It may be beneficial to make your goals out to 6 months or more. Usually resolutions get forgotten or dropped after a couple months because there's no long-term plan in place. Take action. I think this goes without saying that goals or resolutions cannot be reached if you only talk about them. Don't forget to keep it all into perspective. Make sure your goals are realistic. It is also important to identify potential obstacles. For example, if you end up having a goal to walk 7 days a week and the weather calls for a snowstorm, then maybe you will not be able to walk outside that day at least. Be accountable. If you don't hold yourself accountable, then you're only cheating yourself and will make it harder to reach your New Year's resolution. Lastly, it is good to reflect and adjust. If you set a goal that you think is smart, but as you go along, you are unable to achieve it in the time frame given, then you may want to adjust it. For the rest of the presentation, we will talk about healthy nutrition, activity, and lifestyle changes that you can make because likely your New Year's resolution involves making healthier decisions. First nutrition tip is to increase your fiber intake. Fiber helps maintain our digestive health and helps us feel fuller longer. Suggested daily fiber intake is 25 to 30 grams for women and 30 to 35 grams for men. Some ways one can do this is by choosing higher fiber cereals or oatmeal. You can add berries or almonds to your yogurt or cereal. Another way is to add beans to your salad. If beans aren't your thing, then berries or almonds can be added instead. Fruits are high in natural sugars, and our body processes these better than added sugars than what we find in desserts. Substituting fruit for dessert and incorporating it into your snacks in between meals will help with your fiber intake. Another snack substitution can be celery and carrots. A hack is that they stay crisp when stored in water. Another health tip is to limit added sugars. Too much added sugar in your diet can contribute to weight gain, obesity, type 2 diabetes, and heart disease. The CDC recommends added sugar intake per day should be 10% less than your daily caloric intake. For example, in a 2,000 calorie diet, 200 or less of your 2,000 calories should be made up of added sugars. 200 calories is about 12 teaspoons of sugar. 1 teaspoon equals about 4 grams, which can help guide you when referring to the nutrition label on food products. Some ways that we can limit added sugars are to limit sugary drinks such as soda and juice. Water or seltzer are great substitutes. If you hate the taste of plain water, then adding lemons or other fruits can help with the flavor. Added sugar levels are high in most cereals. Refer to the nutrition label. Adding berries to your cereal not only will help with the fiber intake, but also with that sweet taste. As we now know, fruits and vegetables can help boost fiber intake. They also can be a great substitution for sugary snacks. Other common added sugar sources are flavored syrup or plain table sugar added to your coffee. Again, refer to the nutrition label to help limit the amount of added sugars in food and drink. Within the past year, the FDA came out with an updated nutrition label. Without getting too involved, I'll just touch base on item number 4 in this image. They have included the amount of added sugars contained in prepackaged food products. Limiting our salt intake can help with maintaining a healthy blood pressure, kidneys, and heart, and reduces our risk for stroke. Instead of using table salt to flavor our meals, substitute lemon juice, no salt seasonings, and fresh herbs. Salt can be found in processed and prepackaged foods, and surprisingly, you can find high amounts of sodium in breads, pizza, and deli meats. Moving on from nutrition tips, we are now going to talk about healthy active and exercise changes you can make. First tip is parking far away from work or grocery stores. This can help increase our step count without taking too much extra time out of our day. Try taking the stairs instead of the elevator. Moving each hour is a healthy goal, especially now that a lot of jobs have changed so that you can work from home. Now that you are working from home, you are eliminating the steps that you would take to walk to your car, then from the car to work, and then maybe the steps you would take to a meeting or around the office. You can also take a walk on your lunch break, even if it's a short one. If you are one who is working remotely, try accessing your meeting on your phone or take a walk while listening in and make a point to stand at every meeting. Lastly, you can start a fitness competition with your coworkers. This is one way to hold others and yourself accountable, which is motivating. Next, we are going to go over some basic exercises you can incorporate into your daily routines. This can help improve your overall health and help break up sedentary chunks of time, especially if you have a desk job. First one is stretching. Stretching is great for injury prevention. First stretch is for your neck. Simply bring your ear down towards your shoulder. This helps stretch your upper traps that are often tight. Seated hamstring stretch is done by straightening your leg out in front of you while sitting and flex forward at your trunk, avoiding a bend in your back until you feel a stretch in the back of your thigh. A doorway pectoral stretch is done by standing in a door frame with your arms out against the frame and then shifting your body forward until you feel a stretch in your chest. As pictured, this can be done in any corner in a room. Next, we're going to go over arm exercises. These should be done with light weights at first and then progress from there. Bicep curls are done by holding a weight in your hand. Then you bend your elbow to bring your hand towards your shoulder. A shoulder press is when you have your arms up and out to the side like you're making a field goal symbol. Then you press your arms up and towards the ceiling. Last one is an exercise to help strengthen your triceps. One way to do this is to do a bent over tricep kickback. Find a support such as a chair. While standing, bend over and support yourself with one arm. With your other arm, hold a light free weight and keep your elbow at your side with it in a bent position. Start by extending your elbow as you straighten your arm and lift the weight as shown. Return to starting position and repeat. Next section of exercises will cover leg strengthening and stabilization. First exercise is strengthening our hip in 4 different directions. While standing next to a chair or countertop for support, raise your leg out to the side. Keep your knee straight and maintain your toes pointing forward as best as you can. Then lower your leg back down and repeat. Next is hip extension. So instead of raising your leg out to the side, you will raise it behind you. Hip flexion is the third range of motion. This is done by raising your leg out in front of you. Last range of motion is hip adduction, and this is the most tricky one. While laying on your side, slowly raise up your bottom leg towards the ceiling. Keep your knee straight with the entire time. Your top leg should be bent at the knee and your foot planted on the ground, supporting your body. Next exercise is sit to stands. Start by scooting close to the front of the chair. Next, lean forward at your trunk and reach forward with your arms and rise to standing without using your hands to push off from the chair or other object. Use your arms as a counterbalance by reaching forward when in sitting and lower them as you approach standing. Lastly, single leg stance. Somebody took control.
I'm so sorry. I clicked it by accident.
That's okay. I took it back. Lastly, single leg stance. Stand on one leg and maintain your balance with a support close by in case you lose your balance. Next, we're going to go over core exercises. Having a strong core is important to prevent back problems. Low back pain is the most common diagnosis in the US. First exercise are reverse crunches. Sit in a chair and then lift up both knees as shown. Lower back down and repeat. Allow your pelvis to rock a little forward and back to engage your core muscles. Next is quadruped alternate arms and legs. While in a crawling position, tighten your core and then slowly lift a leg and opposite arm upwards. Your hip will move into hip extension on the way up. Lower leg and arm down and then repeat with opposite side. Maintain a level and stable pelvis and spine the entire time. Last exercise is an incline plank. Stand in front of a table and then take a step backwards with both feet as you place your elbow on the table. Maintain a straight spine as you hold this position, then take steps forward to return to a standing position and repeat. You may need a pillow on the table if it's too uncomfortable on your elbows. This is a timed exercise and you can progress by increasing the time you are performing the exercise or use a lower table or support. Cardiovascular exercises help prevent excess weight from accumulating. It also is great for your heart health. All these exercises in particular are low impact, which is easier on our joints. First one is walking. This is one of my favorites because it's low impact and can be done in many different settings, such as inside on a treadmill, outside on a sidewalk, or even in a shopping mall or grocery store. Next is a bike. This can be upright like a bicycle or a recumbent bike where you're sitting with a back support. Last is an elliptical. This is a very specific machine that can be purchased for home use or found at a gym. In summary, goals are key to achieving our New Year's resolutions. Start small because establishing new habits can be challenging. You may slip up, but if you do, don't give up and just pick up where you left off. Here's a closing quote that I found relates to the theme of this presentation. The way to get started is to quit talking and begin doing, by Walt Disney. If you think of questions later on, or if you're watching this as a recording, feel free to email me and I'll get back to you in a timely fashion. And questions. Now we have some time for some questions. So if you want to unmute yourself, take turns.
Hi, this is Louise. I was curious if those exercises will be printable for us so we can take them home.
I can make that happen.
Okay.
I've got a question, Natalie. You know, finding time seems like it's the hardest thing, at least for me. Do you, if you had to choose between doing cardiovascular exercise or something with weights, is there one you would recommend over the other? Or does it not matter as long as you do something?
I feel like if you have less time in a particular day, doing free weights or those exercises, that might be easier to squeeze in. Because cardio, typically it's good to do, 20 to 30 minutes of cardiovascular exercise to get those benefits. I mean, you can alternate, one day you do the bike or walking and the other day you do your exercises. I think it also depends on your goal. If you're training for a marathon, you probably are going to focus more on running than lifting weights. But if you're looking at kind of losing weight, you can kind of count how many calories you burn on your treadmill. But you also burn a lot of calories lifting weights too. So I don't think one is necessarily better. I think it's patient specific.
Thank you. Natalie, oh, go ahead, Louise.
Do you recommend if you're setting a goal to lose weight, be more active, do you think starting at home, if you've done nothing for so long with just stretching like the stretches you showed, would be better than going to the gym and jumping in and probably hurting yourself?
Yeah, these exercises that I gave, I think they're very generic, and I did that on purpose so that I'm not, predisposing you to injury or giving them to somebody who, they don't necessarily don't work for them, I guess. So I think it would be good to start out with those exercises and stretches. And then as you feel like, you're progressing in weights, maybe you only have a 2-pound weight at home and you're like, you know what, these are starting to get easy for me. It might be a good time to transition to the gym, and you can do the same exercises at the gym just with more weight. Or you can also experiment with the different cardio machines that they have there. You might just have a treadmill at home, if anything at all. And at gyms, they usually have all of the different kinds. So it's just nice to have it, switch it up kind of.
Okay, thank you.
I was going to ask you, Natalie, if you set goals or resolutions at New Year's time each year as an ATC. Is that a usual thing for you?
Yes, I have not done any specific goals, but my ultimate resolution, I want to lose 10 pounds. I just had a baby in July and I'm pretty motivated to try to get back to my body or get my body back.
Nice. Anyone else have questions, comments, thoughts? If you'd rather, you could just type them out into the chat too. If you don't want to necessarily unmute yourself, that's an option.
There's my email again too, if you wanted to do that.
If there are no more questions, we can end a little bit early, give you a few minutes back in your day to get on to your next thing. Natalie, do you have any parting thoughts for folks?
I don't think so. If you choose to make a resolution, then I just say, just stick with it. Don't give up.
Well, thank you for the inspiration.
Thank you.
Welcome. Thank you.
Have a great day, everybody.
Thanks, Natalie. Great job.
Thanks.
Thank you.
Do you want me to press stop recording?
Maybe we'll wait right to the end. Marianne, I can see that you're on the meeting still, and I know that you were one of our folks from the community. Did you have any questions?
That's my mom.
That's your mom.
Oh, she doesn't know how to turn off her mic. Turn it off.
Still muted.
Did a great job.
She did do a great
Yep.
job.
Yep.
Thanks for joining us. Thanks
Yep,
again,
thank you.
Natalie.
I wish I would have known I could have added some people from UVM to view it. I didn't realize it was open to like anybody because it's very informational and it would have been, it's just great.
Agreed, and that's a good thought. I'll have to make sure that we mention that next time so that people know in advance and we can do that.
Sounds good.
Could
All right.
probably send them the recording or something. I don't know if that's a thing.
Yeah.
Send them the recording in an email.
Sounds good.
Absolutely. All right.